The BRD hospital in Gorakhpur, Uttar Pradesh is the port of last hope for thousands of desperate parents in a 300-kilometer radius with infants suffering from diseases like encephalitis. The hospital has been in the news due to hundreds of deaths that took place here this August, many when it ran out of its supply of oxygen. 1 year ago on September 7, 2016, Congress Vice President RahulGandhi visited the BRD hospital. Unfortunately, his warnings about the state of affairs at the hospital and the shortage of funds were ignored, with tragic consequences.
I went to this same hospital, Gorakhpur hospital. In fact, I've been there a couple of times. Every time I've been there, it's because of encephalitis. Just last year, I went there again. And I categorically told the press and told Mr. Modi that there is a problem developing here. The doctors were complaining, the patients were complaining, and everybody in the hospital. I mean, the words used, I'll tell you the words used in Hindi. हम यहाँ जीने नहीं जाते हैं, हम यहाँ मरने जाते हैं। डॉक्टरों ने हमें कहा कि जब यूपीए की सरकार थी तो काफी फोकस था, काफी इफेक्टिवली काम किया गया। दुख की बात है कि अंदर मुझे बताया गया है कि जिस प्रकार से हम फोकस कर रहे थे, जितना पैसा हम भेज रहे थे, वो अब एनडीए की सरकार नहीं कर रही है।
Between 2012 and 2014, the UPA government increased the allocation to the health mission in Uttar Pradesh from 2,200 crores to 3,600 crores. But when it took over in 2014, the NDA government led by Prime Minister Modi drastically cut funding to the program.
There is a view in the government, in fact among people, particularly affluent people, that the Indian healthcare system can be run by private hospitals. And this is simply a lie. In a country like India, where most of the people are poor, you simply cannot do without a public healthcare system. You simply cannot do without hospitals, public hospitals that are effective and efficient. It just will not work. You are condemning thousands and thousands and thousands of people to death because you do not have a public healthcare system that works. You're not spending nowhere near the amount of money. I mean, when we were in government, we increased the amount of money. We pushed as hard as we could to improve the public healthcare system. But the current government really does not care about healthcare. That's the fact.
When funds to public healthcare programs are cut, people die. Across Gorakhpur district, thousands of grieving families who have lost loved ones in the latest deadly outbreak of encephalitis are a testimonial to that fact. Even as Rahul Gandhi travelled through Gorakhpur district meeting grieving families, some critics mockingly referred to his visit as a picnic. Here's what he had to say.
The people who say this, that is how they conceptualize it for themselves. They view any show of empathy, any attempt at understanding people's pain, any attempt at trying to hold hands as a cynical exercise. Because that's how they think, that's their mind. For me, as a political leader, visiting Gorakhpur when it was in pain, visiting those families was an extremely powerful experience. Number one, I was able to hold their hand and tell them, listen, I'm here with you. I was able to offer them whatever little help I can. We're not in government, but I was able to offer them that. But much more importantly, they were able to tell me what they faced. They were able to explain to me how the government of India let them down. As a political leader, that's fundamental for me to understand. What am I doing if I'm not understanding that? What is the point of my work if I'm not understanding that?